Good morning, dear colleagues. Let me present cross-sectional online survey to determine the knowledge, attitude, and practice of the participation of tobacco cessation among healthcare workers in Russia. Tobacco use is a leading risk factor for death and disability worldwide, especially in cardiovascular disease. Cigarette smoking is responsible for 50% of all avoidable deaths in smokers, with half of these due to ASCVD. A lifetime smoker has a 50% probability of dying due to smoking, and on average will lose 10 years of life. In 2010, the American Heart Association introduced the concept of cardiovascular health, which currently includes 8 components, among them diagnostic indicators: blood cholesterol, BMI, BP, blood glucose, and behavioral factors: sleep, diet, quality, physical activity, smoking, high BMI, fasting plasma glucose, and among the major risk factors for disability over the past 30 years. Stop smoking is potentially the most effective of all preventive measures, with substantial reductions in myocardial infections or death. Modern guidelines offer several options for quitting smoking. The first option is a complete cessation of smoking for patients who are ready and able to quit. The second option is anti-nicotine therapy, such as varenicline. The third option is nicotine replacement therapy in different delivery forms: chewing gum, inhaler, spray, or patch. As another option for patients who are unable or unwilling to quit smoking, both European and American guidelines consider non-combustible products such as e-cigarettes and electronic tobacco heating systems. Thus, the tobacco control strategy can be divided into 3 stages. First, smoking prevention. Smoking prevention strategy is lifestyle, social, economic areas, and so on. Second, smoking cessation strategy of psychological and drug support for smoking cessation. Third, if the previous stages were unsuccessful, reduce the harm from smoking using modern smokeless technologies. It takes integrated work between the patient, doctors, and government for the strategy to work effectively. Steps need to be taken by government to create an environment in which products regulations will be proportionate to the harm caused, and there will be possibility of informing smokers of less harmful alternatives. The 5A framework for smoking cessation: ask, advise, access, exist, and arrange has been widely recommended for the delivery of brief advice in primary care outpatients visit in guidelines. Therefore, this study aimed to determine healthcare workers' knowledge, attitude, and practice the participation of tobacco cessation. A cross-sectional survey study was conducted among healthcare workers working in Russia using a self-administered online questionnaire in 2022. Participants were healthcare workers aged 18 years and above from 8 regions of Russia. There were 57 specialties, of which 29% and 21% were internists and cardiologists, respectively. We used a 5-question questionnaire. 79% of healthcare workers ask about smoking history, regardless of whether there is smoking-related illnesses. 89% of physicians believe that smoking cessation advice given by a healthcare professional improves a patient's chance of quitting smoking. Quitting must be encouraged in all smokers, and passive smoking should be avoided as much as possible. Very brief advice may be advantageous when time is limited. A major impetus for cessation occurs at the time of diagnostic or treatment of CVD, prompting a person to try to quit brief reiteration of CV and other benefits of quitting, and agreeing on a specific plan with a follow-up agreement are evidence-based interventions. As we know, non-combustible products deliver inhaled nicotine by heating rather than burning, unlike conventional cigarettes. In the case of electronic tobacco heating system, nicotine is released from tobacco, while electronic cigarettes or e-cigarettes vaporized it from solution. According to the result, only 28% of doctors were aware of the principle of the difference between electronic cigarettes and traditional cigarettes. The same number of physicians knew the difference between using non-combustible tobacco products and traditional cigarettes. Thus, efforts of healthcare professionals are not aware of the different methods of nicotine delivery. The greatest harm of tobacco smoking is caused by combustion products. 75% of respondents agreed with this statement. Indeed, combustion products are the main factors responsible for the prothrombogenic, and pro-inflammatory activity of the endothelium and cancerogenesis, while nicotine is largely responsible for the formation of physical and psychological dependence. By the way, the rationale for the electronic tobacco heating system is based on the principles of reduced harm by reducing the concentration of combusting products by 90%. Conclusions. Much of the medical community is unaware of how e-cigarettes and tobacco heating system works and how they differ from the traditional cigarettes. The medical community needs to be educated about the concepts of harm reduction of the difference between smokeless products and cigarettes. It's expedient to introduce sections on THR in physicians' education programs or clinical guidelines. This strategy would help adult smokers who are not motivated to quit get qualified advice from a physician, not only from a complete quit perspective, but also from a harm reduction perspective. Thank you for attention.